From the JAMA Network, this is JAMA Otolaryngology Head and Neck Surgery Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Otolaryngology Head and Neck Surgery.
Hello, this is Paul Bryson, your web editor for JAMA Oto and host for our podcast series. Today, I'm delighted to be joined by Dr. J. Piccirillo. He is the professor and vice chair for research at Washington University, Department of Otolaryngology, Head and Neck Surgery, and our editor-in-chief for JAMA Oto. I'm also joined today by Dr. Azadeh Afshari, a prosthodontist and instructor in the Washington University Department of Otolaryngology. Today, we're going to talk about their recent study, which is a randomized clinical trial looking at mandibular advancement versus combined airway positional therapy for snoring. Drs. Piccirillo and Afshari, welcome to the podcast.
Thank you. Happy to be here.
Thank you. Happy to be here and to share our research.
Yeah, as we dive into this, just as a specialty, we don't have a lot of randomized clinical trials, and management of sleep disorders and snoring is pretty important. It affects a lot of patients, and particularly in this era where CPAP is not always tolerated or comfortable. Can one or both of you explain the motivation for the study and how you arrived at this trial?
Sure. I'll go ahead and give the otolaryngologist perspective. As we all know, so many of our patients complain of loud snoring, and so many of our patients' sleeping partners complain of loud snoring, that it seemed like a good study to compare a conservative treatment, nasal dilators, nasal rinse, with a jaw device. And, I've had the pleasure of working with Dr. Afshari for a while, and she was quite bullish about the device that she has been using and sort of lent itself to a logical clinical trial of comparing the conservative treatment versus the jaw device. Let Dr. Afshari give her perspective on the motivation for our trial.
I too see a lot of patients who suffer from snoring and spouses that also complain about the snoring. And it's nice to have a device that's relatively simple to use, and patients can find effectiveness by using it and see great results. To be able to share a bedroom or go on a vacation is improving the quality of life.
Yeah, and you're right. I think it's very common. How did you join forces to create your groups? And can you tell the listener, how did the groups break down, and explain the interventions a little bit? Talk to us about mandibular advancement versus the combined positional therapy. What does that involve?
Sure. So the mandibular advancement device, the one in particular that we use, is a precision device with 3D accuracy. And what this means is that it's quite comfortable for the patient. It does have a level of flexibility to it and allows for ample tongue space, which I think is very important when you are trying to move the tongue forward. And that's exactly what it does. It attaches to the teeth and connects within itself to move the jaw forward. And it is titratable by the patient. Of course, I help guide the patient, but the patient essentially titrates themselves. And I think that comfort is what helps with adherence and allows for a more effective treatment.
Yeah, it sounds nice that the patient can titrate it, and I would imagine there's a lot of devices on the market. I wanted to highlight to the listener, I understand neither of you have any conflicts of interest with, any company or this particular device company in general. But have you tried other devices, and this is the one you've settled on or is most common in your practice?
I have. There are many devices with different attachment and propulsion mechanisms. I like the simplicity of this device. There's no springs or coils or other materials attached to it. It's made of a homogeneous material, a medical grade class 6 material. It is not porous, biocompatible, and very hygienic, and very, very strong. So I just like the design of this device and the simplicity. And I think that simplicity allows for patients to not have mechanical issues with it as much as maybe some of the other devices.
And Dr. Piccirillo, what's the combined airway positional therapy for snoring? What does that comprise?
Combined airway and positional therapy involves 4 different treatments, if you will. So number 1 is the use of nasal saline lavage, like a neti pot, with the addition of budesonide, a topical glucocorticosteroid to reduce inflammation. Number 2 is the use of a breathe right nasal dilator. Number 3 is a mouth tape placed horizontally across the lips at the columella. And then the 4th intervention as part of the combined airway position is the positional therapy. That would be lateral positional therapy. So I, for many years, have been recommending this to my snoring patients. And in fact, I've personally used it and found it quite effective. So the combination of the neti pot with budesonide, or neti cort as we call it, neti cort, breathe right, mouth tape, and lateral positional therapy is the combined airway positional therapy we use in this study.
Any barriers to randomization? Did people have strong opinions about one or the other, or did you find a pretty receptive group of participants?
So for this study, we recruited adults with snoring from the Washington University Otolaryngology Clinic and the Sleep Medicine Clinic. And we were looking for patients who have snoring but do not have sleep apnea. We also put advertisements up around the medical center. And as you might expect, we had no problems with recruitment. In fact, everyone was quite enthusiastic about this study because snoring is such a major problem. And we also had no problem with the randomization. So the patients, through informed consent, were informed of the 2 different treatments, and they really are quite different. But no one really had any problems entering the study or understanding that they would be randomized to one treatment over the other. I think that Azadeh can talk a little bit about some of the joy and excitement she saw in the patients that were part of the project who got randomized to the mandibular advancement prosthesis.
Yeah, sure. I saw the patients once they were randomized, and I think my patients were all pretty excited for the device. They felt like, they won the golden ticket. And so they were pretty motivated to try and use the device. They get to have something they take home to help them. So it's like a toy.
Yeah, that's very fun. So tell me, what did you find? Just, maybe give us a little summary of the outcomes and, what feedback did you get from your patients?
So this was a great trial because the participants, both the snorers as well as the sleeping partner, and by the way, the primary outcome measure was the response to treatment as recorded by the sleeping partner. Because as we all know, so often the snorer is not aware of it themselves. So in both arms of the study, both the sleeping partner and the snorer reported good improvement in sleep and reduction of snoring. Our primary outcome measure was a global impression of improvement, again, from the sleeping partner. And so the question was, overall, how would you rate your partner's snoring? And the options were very much improved, or no change, minimally worse, some worse. And we called responders anyone whose snoring was very much improved or much improved. We had 42 pairs, and we had 25 of them were randomized to the mandibular advancement prosthesis, and 23 completed the study. And of those 23 pairs, 21 or 91% of the sleeping partners reported that their partner's snoring was very much improved or much improved. So 91% response rate among the mandibular advancement prosthesis. And then of group 2, the combined airway and positional therapy group, we initially randomized 25 pairs. We had 19 finish the study. And of those 19, 11 or 58% reported very much improved or improved. So again, while both groups showed improvement, by far, the group randomized to the mandibular advancement prosthesis showed a much greater improvement.
That's great. I love that you engaged the bed partners too, because I imagine you get a lot of different input. Any other surprising findings as you looked at the 2 groups? Any findings that you think will spur some other collaborations like this?
While the primary outcome measure showed a large difference, it wasn't statistically significant, and we can't say definitively that the mandibular advancement prosthesis was better, as reported by the sleeping partner. And the secondary outcome measures, such as the Epworth Sleepiness Scale and the Snore 25 and some other measures, really didn't show as large of a treatment difference or treatment effect. So overall, we can't definitively conclude that the mandibular advancement prosthesis was better. It certainly, from this pilot and small randomized clinical trial, looked to be quite a bit better in a clinically meaningful way. And I really wanted to share with your listeners some of the anecdotes that Dr. Afshari and I heard from the participants. So one in particular was from an 80-year-old. We had an 80-year-old couple enrolled in the study. And the snorer said, quote, "Because of my snoring, my husband and I chose to sleep in separate rooms for quite some time. But after 58 years of marriage, we're now back in the same bed."
Oh, wow.
And that was wonderful. And then another said, "The mandibular advancement device has been life-changing for me. My snorer," referring to her partner, "my snorer is not snoring at all. We will be continuing to use the device." And then finally, "Before the study, I was thinking about starting to sleep permanently in another room." And I know Dr. Afshari was hearing those type of statements too.
Absolutely. Absolutely. And the partners would sometimes come to the follow-up appointments and would share that. Sometimes the partners were more excited about the results than the patients were.
I mean, it's such a big impact. That's really impressive.
Well, Paul, it was such a big impact. And my research coordinator, Dr. Patrick Yeager, was doing a year-out research with us. And Patrick did a wonderful job, running this trial, basically. So periodically, I'd say, "Well, Patrick, how's it going?" And, it was really funny. A big smile would come across his face. He says, "Well, Dr. Piccirillo, all the patients and participants are doing well, but boy, they really like the jaw device." And so after the trial was done and the results confirmed what Patrick was sensing, I went to Dr. Afshari and asked for a jaw device for myself. She made me one.
Yeah, any what are the early findings?
Yeah, just like we found in the study. I am very pleased with it.
That's great.
As well as my wife.
Yeah, that's great. Well, I mean, it seems like this opens up some interesting possibilities for some more research and collaboration. Any other parallel topics or things that you guys are interested in moving forward?
Yeah, I mean, one of the things that Jay and I have discussed potentially looking into is hypoglossal nerve stimulation. And the idea is, will this work in comparison to the hypoglossal nerve stimulation? And I'm curious, I would love to look into a study that compares the efficacy of using the device versus having to have surgery. And if the device, if it's comfortable, patients are excited about it, and it's not cumbersome for them to use, and it's not a bunch of steps. And, if snoring patients are this excited about it, then what about our sleep apnea patients? And will they also see such positive results with it as well?
Yeah, I mean, you could envision all sorts of things, right? Like looking at dice with and without the appliance. Yeah, gosh, just looking at some of the polysomnographic data too.
Paul, one of the things that impressed me about this study that I wasn't expecting to see, and I talked to Dr. Piccirillo about this, I really did not think, I know that when patients have sleep apnea and they have a CPAP and they're used to wearing all these tubes and this mask that gets in the way that makes all this sound, it's already a very uncomfortable experience. So typically with those patients, if I put them in a mandibular advancement device, they love it. It's the best thing for them. They are doing cartwheels down the hallway. They're so happy they can travel with it. It's a smaller thing. It's not as obstructive for them or cumbersome for them to use. But I wasn't expecting to see this for our snorers, our patients who their partners are probably more bothered by their snoring than they are. I thought that they would rather do the mouth taping and other modality compared to wearing a device in your mouth while you sleep. But I think that just kind of goes back to the device selection and picking a device that's comfortable for the patient so that they don't feel those discomforts. I was quite surprised to see that they like the device. I know both modalities work, right? We know that. But to have something in your mouth all night, that's impressive that had such a good result. There's something to say about that, I think.
So what I think we're looking at, Paul, is to begin to test this device in patients with sleep apnea, whether that be mild sleep apnea, moderate sleep apnea, or patients who fit the criteria for the hypoglossal nerve stimulator, like Dr. Afshari said. I think we're just really enthusiastic to kind of move on to see how this device works in the different settings that Dr. Afshari described. Azadeh, do you want to just talk about the, quote unquote, adverse effects or some of the jaw discomfort and how you manage that?
Of course, of course. So the adverse effects of using a mandibular advancement device is going to be jaw discomfort, number one. That's the first thing that patients may notice. And as that mandible is protruded forward for 8 hours a night, fluid can build into that joint space. So in the morning, the patients may feel that their teeth don't touch or that there's some discomfort there. And we remedy that by giving them a morning aligner that they should use. And then the discomfort goes away and it's really not a big deal. And I think some of our patients experience this and then slowly got used to it or then didn't have this experience later on. Another issue that can happen with wearing any type of mandibular advancement device is teeth can shift over time. Now, again, this device is, a precision device with 3D accuracy. So it minimizes that aspect of the teeth shifting. I would not venture to say it's impossible for that to happen, but it minimizes that from happening to such a high degree or noticeable degree. So there are potential side effects. And we, in fact, had one patient that was like, I just can't stand having anything in my mouth at night. It's very uncomfortable for me. So one of the patients that stopped using the device did have that, but most of our patients did pretty well with it because it does not take up too much volume in the mouth.
Yeah, it's good to hear it. It seems like such a reasonable thing to at least try, for that patient that might benefit. There's not a lot to lose, particularly if people are having a tough time.
Can I also talk just briefly about the cost differential?
Yeah, of course.
Okay. So while the patients on the mandibular advancement prosthesis really did quite a bit better than the patients randomized to the combined airway positional therapy, we would like to note that the device does cost more than the Band-Aids and breathe rights. And so it's not unreasonable to think that maybe the low-cost treatment option, the positional therapy with the breathe right, et cetera, might not be bad as a first choice. And certainly if the patient was snoring and the sleeping partner are happy, well, then that's fine. But it's nice to know that if that simple low-cost treatment option doesn't work, then there really is a much more effective treatment available. That's the mandibular advancement prosthesis. So I think the results of the study will hopefully lead to a shared decision-making discussion with the snoring patient and their sleeping partner as to, two options are available. They're different in different ways, and they also cost different. And that can really lead, as I said, to some shared decision-making discussions.
Well, I really appreciate both of your time. I congratulate you on this work and publication. I'd encourage the listeners to check it out and to look for more to come from your collaborations.
Well, thank you, Paul, so much for selecting our article to highlight with your podcast. It was a pleasure.
Thank you so much, Paul.
This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening, and we'll see you next time.